Any questions? We have a gentleman here. Microphone there.
Nerijus Šinauskas from Health Economics Center. I have a question for Žilvinas Padaiga. You mentioned that there's a lack of coordination between different sectors. And my question is, you always see it from this, what other sectors can do for health sector. Let's say they can improve road quality, let's say. But other sectors, let's say Ministry of Energy or Ministry of Finance, they're interested in their own sectors. So maybe if approach of the health ministry would be to, let's say, you do this for health, but we do this for the energy sector. Let's say a hospital builds some kind of a small energy supply, so it becomes more energy independent. Or a bit of your training for clinics also goes to provide services for the military, something like that. Then it might help integrate these two sectors, because a lot of just one way that talk might not get the outcomes that we actually seek for.
You mean I give you one thing if you give me?
Yeah, simple.
Like Christmas?
Simple economics.
Can you fix Christmas?
Well, I'm always very happy when I see young and motivated and excited people like you. Kind of once upon a time I was like that, also wishing to fix all this. And then with time you get a bit more reserved, because you try this and that and that and that and this. And my answer to this would be yes, why not? If it works, any approach would help. Any approach. So the scene actually is yours. Come on scene and try to fix it with your own ideas.
Okay. We leave it to the young people, so I say goodbye then. But I will not, because I am experienced now, in a way, on a level I wasn't when I was younger. I don't know, I don't say it's better experience, but I have different experience. I'm still thinking of if I used to be a minister, or if I'd been a minister, or if I were a minister, what I would have done. And one of the things that Stan said, you have 50% co-payment out of the patient's pocket. Do you mean does that include also insurance?
No.
Take it.
No. This is payments that
directly from my own wallet.
From your own wallet at the moment when you have to enter hospital, because we have some practices that I'm really not proud of them, but for example, you have to pay for choosing your doctor, and it's not the patient will, but actually whenever you go to hospital, the hospitals have to somehow generate some money to co-finance what they need, because the healthcare system is paying so small amounts of money. So they're asking the patients to pay for choosing your doctor, choosing your room, choosing whatever. So at the end of the day, 50% of the money and the costs are coming from your pocket directly at the moment when you are most in need. It's the moment when you are sick.
Okay. I'm thinking of, we have a person in the audience here, which I blame you, Zil, for putting on stage, or at least alert, and that is Professor Galdikas. I don't know where you are. There you are, yeah. I'm coming to you now. He's a former minister as well, so he can't blame someone else. He has to take his own responsibility. You started a health insurance fund, or you are engaged in that. Was that the reason for helping the co-funding, or why did you do that? Isn't that a good question? A microphone is coming, yeah? Sorry for just jumping into you.
Generally, it was the decision of our politicians. It just
you just follow order.
Occasionally, I became the minister and had to implement it.
Ah, so you're just a lucky guy.
Yes.
Okay, so now you're a lucky guy in the insurance area.
It's I'm now a little bit far from health insurance. I'm working for licensing, health quality, such kind of devices, HTA. So health insurance is the whole system which we have in our country. In finance, I think more than 75% from the whole expenditure for healthcare. So maybe some from health insurance fund, people who can explain a little bit more, but generally physicians are more or less satisfied when we look to the curve, what's happened in the last 15 years. So we can say we are moving forward or going forward. So could be better, yes, it could be better. It's up to a young generation to do it better.
Okay. Okay.
We have a vice director of health insurance fund. He's sitting at the back, Gintaras Katsevičius. He also has quite an experience in this field.
Okay. Blaming you again. Could you please answer? It's dangerous to sit in this room. Now they're trying to blame each other over there. So we have 2 microphones, so no problem to
Gintaras
sharing.
did lots of expertise as an expert in many countries of Central Eastern Europe.
Okay.
So he knows
We are in the solution area now.
First of all, I have to remark that the real vice director is sitting in front of me, so I'm not in such a high position. Yeah, but I'm sorry to say, but I was a bit working with my other things. So if you repeat the question, I would try to answer.
The question is the answer of co-payment, the risk of co-payment, and the out-of-the-pocket payment, is the answer to have a stronger insurance or private insurance, or do we need to push more for that the taxes should be enough?
I have, from my point of view, the answer is the alternative number 2, because of all of us, we know a lot of evidence about the effect of co-payments, yes, and we know that co-payments could give us expected, as also unexpected results, such as some people cannot go for services because of co-payment, but they need for that. So, in my opinion, the solution is just trying to generate more public resources for funding of healthcare.
Okay. To have it diverse, so we are not put all eggs in one basket. Okay. I don't know if that was a good picture, but I understand what I meant. I'm still thinking what we know everything. Yes. Someone from the other side of the cost.
Lucas Pfister from MSD.
No, it doesn't.
Should I this way?
Like a rock star, you know.
All right, I'll try to sing. I'm still struggled by the question about insurance system. How to come up? How can it's in its infancy. It's a solidarity movement among people, so that those who are at need don't go bankrupt, basically, through their health situation. Now, the question is, if the governmental system is not up to speed to do that, what is the potential for private insurance to come up, or cross-border health insurance? And the service, the freedom of services in the health sector has not been established in the European Union. Is that an element? And I think for those who have maybe in the government or close to governmental circles, what is the readiness or openness to embrace a more liberal health insurance system in their countries to supplement or replace a deficient governmental insurance system?
Thank you. Very good question. Actually, I think, and it was raised a couple of times, even this morning, we were talking that there are differences between some of the health determinants depending on which political party actually. Is it the left wing or the right wing? So I was thinking, can we always depend on the willingness of a government to do something. Because I'm coming from a country that I can assure you that our government is simply not willing to do anything for a long time. Or if they are doing something, it's very small steps. In this case, probably we have to think how we could encourage such governments to take actions. Because for me, I don't have an explanation of the fact that the lowest GDP country as Bulgaria, and I suppose this is a case for many other countries with low GDPs, we still have the lowest percent of this small GDP going to healthcare. And we don't see a trend where our governments actually show at least any interest to increase that or to find ways or to introduce new practices. So it's not strange that health inequalities are actually deepening and deepening in such countries. And if we have such cases, what do we do? Can we actually start thinking for introducing standards? Isn't it time? Until when we are going to wait? Until the situation is so bad that the system simply crashes? Or countries as Bulgaria don't have the right to continue being EU members, or what? Or when all patients are actually going to move into more normal, let's say, countries and try to surround their systems and start working there or find job or have better insurance and better access to healthcare. So I think that it's time for us now really to think how we can encourage those governments. Do we need European standards? Do we need standards for treatment? Do we need standards for timing of introducing innovation, reimbursement levels? So it's not strange that even yesterday the Lithuanian minister was talking actually for opening the treaty or rethinking the European Constitution. But I think that it's not normal that we have standards in Europe for the size of the eggs, let's say, or how our chickens should grow, how free, and not talking about such an important issue as health that actually concerns people's life.
Okay, we all agree and we need to do something. I was thinking, when I grew up, we had a long discussions about value of life. What value of life? Equality, that everyone is worth equal, regardless if you can run quick or not. Even what kind of society we want to have. Those kind of questions, we don't discuss them today. We are trying to find quick fix. We're talking about insurance, we're talking about access, equity, and other things. But we need to put all this together where everyone can meet. So I would urge the young people, you are part of the solution. I wouldn't put this on your burden, that on your shoulder, that you are the solution. Because I think we need to find it together. I would urge everyone to bring in to your society, to your community. Start to talk about, to try to find some idea about what kind of society do we want to have. I say in Sweden seems now that that is paradise to live. I live in Sweden, I can assure you, it's not paradise every day. Some days it's paradise, some perspective is very good, some perspective is crap. Because we're also fighting attitude. We're also fighting the everything is falling apart. There is no holistic view and things like that. So if we start to talk about what kind of society do we want to have, then we need to bring in all stakeholders. Then we have to bring in the Minister of Finance. Then we have to bring in the doctors. We have to bring in the people from the social care and also from the patient view. And then maybe if we bring together a new picture of this is the society we want to have, should have that and that and that, then we can order the resources in a different way. Because I think we have to allocate the resources in a different way, and we need to fight for that. So, and I don't think, I'm against insurance. I don't know if I'm allowed to say that, but I like to have a society where the taxes is covering most of the health care when it comes to healthcare, basic healthcare. Because I would like to have a society where everyone can afford to live and when the healthcare is affordable. And that is what I want to fight for. But in a democratic way, of course. We have now 1 minute left. Tom, do you have a final comment?
Thank you, Anders. Tomasz Szolongowski, Federation of Polish Patients. Maybe I will try to give you some hints and tips for the solutions, Stanimir, to your answer as well, and Lukas, to your question. The word is participation. There is a very minimum participation of our region of countries from the Central Europe that have joined the EU in 2004 and then over. When you take a look on an example of European Innovation Partnership for Active and Healthy Aging, there is 261 projects altogether. Less than 10 comes from the Central European countries, the new 13 I would call. The majority, which is 250, comes from the western part of Europe, which is old 15 group of countries. And in my view, that's where the healthcare policy is being shaped, where it's discussed, where it's proposed. And then based on those findings from such a partnership, the solutions from the directives comes in. But our block of countries does not participate in it enough. So that's I would call as one of the solutions, the participation. But it's not just NGOs that I would call for participation. I'm starting from the state institutions that are not involved at all. It means they do not support such a participations. The medical universities does not have enough ambitions to go and motivations to do that, and NGOs as well are not supported to that. So without that participation, we cannot share in a right manner our healthcare funds that we have. We do not inspire our politicians. They don't get the knowledge which is discussed there. So that's I would call one of the fragile area for take a look at it, and it might be solution there.
So you mean that we get the politician we deserve, and we get the society we deserve, because that is linked to how well we participate and engage ourselves?
One other comment. Even when you take a look on examples that are being presented during a conference, even this one yesterday and today, when the graphs are being shown with statistics, majority, I would call 80% of those graphs, are being done in all 15 countries. Very rare examples that you can find the countries from our region, Central European. So you see, the criteria are being based from the programs and the findings that are being, does not include the voice from our regions. So that's why the standards are a little bit higher, and we are just simply cannot afford on this, because our economy is not catching up, you know.
Message understood and received. Final.
Thank you. I just want to come back to your comment on whether we might need cross-country type of insurance, providing that we have the open healthcare market in Europe now with the directive on patient rights in cross-border healthcare. I don't know the answer. It may be a good solution. And what I wanted to say is that basically those type of questions we could be discussed with a broad range of stakeholders who are really interested. And what Stanimir was mentioning, the idea of the partnership approach might really good work for such kind of questions who involve many more people and probably go beyond the governments, the national governments. Thanks.
Okay. So I will not stand in front of between you and the lunch. And our former minister, I will give you the final word because you said in the beginning to me, I want to engage the people in the audience. I want to not frighten you, but make you upset or make you react. And I think you managed to do that. So will you continue that? And I give you the final word.
Kind of, I have the feeling that it was quite a complaining session.
No.
Well, that's my personal feeling. I have the right to have this feeling. And my guess is that we are doing quite well, kind of. If I look at my own university, the changes during the past 10 years, they are enormous. The hospital, enormous. Education, technologies, pharma industry. Actually, there are very many positive things. And my understanding of the solution of health inequalities is that health system somehow has to be pretty arrogant towards politicians, saying that's it, we do not have more resources, give us, support us. and also at the same time to be very compassionate to the patients and do daily life whatever we can do for the patients. And somehow I expect that politicians at some point will understand that other sectors have to do a lot in health inequalities.
Okay.
I have to react really on that because I don't want people to take it as complaining. No, I think that the fact that the patients are trying to bring all stakeholders on European level and starting searching for solutions that might work for all of us is very positive one. And I believe in this approach, and I believe that health insurance is only one of the many opportunities that we have there to explore, but I'm sure that we all together can find solutions that will build a better Europe in future.
Yeah. I complain about the speed. So let's raise the speed and do it together and start discussing what kind of society do we want to live in, and what kind of society do we want to give our children. Thank you, and have a great day, and thank you very much for coming and have a lunch. And to our speaker.